Good afternoon, everybody. Thanks very much indeed for joining this Greater Manchester press briefing this afternoon. Just chaired the 6th meeting of the Greater Manchester COVID Emergency Committee, and we wanted to update you on what was discussed. I'm joined today by Cllr Elise Wilson, leader of Stockport MBC, and Cllr Sean Fielding, leader of Oldham, and I'll explain a little later why they're joining us. But first, on behalf of everybody, want to, of course, convey congratulations from people in Greater Manchester to the Prime Minister and Carrie on the birth of their child. But turning, if I could, to the first update being the statistics, which you'll now be familiar with, which we give every week. Overall, the report to the committee was that cases, new cases, are now levelling off. Which of course is good news. It seems that we are indeed passing through the peak and hopefully beyond. In terms of the numbers that I've given at these briefings, so that you've got a way of comparing what's happening. In terms of patients in intensive care, the figure we gave you last week was 190, and that has now fallen to 136. In terms of patients with COVID but not in ICU, last week it was 942, it's now 827, so you can see the trend. Daily deaths, of course every single death is a tragedy and it's awful talking about them in this statistical way, but nevertheless we have to. We were seeing about 167 deaths every day about a week ago, and that has now fallen to 117, but each and every single one a tragedy. And on behalf of all of the leaders, I would want to convey our sincere sympathies to the families concerned. There is some good news around daily admissions to hospital of new cases, running at about 30 a day last week, had come down to 20 a day, although has jumped up again to 38 on the latest figures. So no room for complacency is what I'd say. We feel that the trend is down, but obviously we'll be keeping a close look on that. With regard to care homes, I've been given figures in the last couple of briefings about the number of care homes in Greater Manchester issuing alerts to Public Health England about clusters or outbreaks. The figure now stands at 287, which is an increase of 31 on the last week. So there is obviously still a real concern around care homes, and that is something we've got a very, very close eye on indeed. So those are the statistics. If I could turn to some of the more specific issues that were picked out today. We have evidence actually of increasing number of people seeking support for people who are homeless. So on the latest stats now, 1,310 people have been supported by our accommodation scheme. And that is obviously a figure that is increasing week on week. It is clear to us that many people are being made homeless by the ongoing lockdown, and we are seeking to get underneath the figures there. There's a significant number of new people presenting for support, and that can be linked to sofa surfing arrangements breaking down, eviction, relationship breakdown, a whole range of reasons, but it is clear that there are increasing numbers of people coming new to the streets, and that of course is challenging, and it's particularly challenging given the funding that we're receiving from government. I've raised my concerns before about the government not paying for people who are newly homeless, only for those who are identified as homeless before lockdown. Well, this is a growing concern in the light of the most recent allocations to councils from the national funding released by the Communities Secretary. And I hope a table is visible to you all as I'm speaking, which shows the allocations that were given to councils yesterday. And as you can see, 9 of our 10 councils received quite a significant reduction in their level of funding, and only one recording an increase. And this is very worrying, given that this funding is meant to pay for homelessness support alongside a whole range of other things as well. And if city regions are going to lead recovery, then they can't do that if the councils within those city regions are facing cuts already and not receiving full cost recovery as they were led to expect. So this is worrying. What we believe has happened is that the deprivation weighting has been removed from this formula that is allocating this funding. But I have to say, even the leader of Trafford Council said today that he didn't think that was right, that deprivation should be guiding funding, and you know, that it would be the Greater Manchester position, and we will be relaying that very directly to the government. We still don't have a funding settlement for Metrolink. We are led to believe it may be arriving later today, but we're also led to believe it will not fully cover the costs that we are losing or that we are paying every week. And that again is a cause for concern, and we need an ongoing discussion with the government about how the city region is going to recover if its councils are losing out on funding in the way that I've just shown you, and also if we are not getting cost recovery on public transport. These are major issues that we need to pursue with the government. In terms of looking at some of the issues that are of course at the front of people's minds, PPE, as a result of Greater Manchester's efforts, the best picture yet was presented to leaders this morning, particularly with relation to supply of PPE to social care. The efforts of our procurement team have come through, and there is a much improved position there. The one item that was flagging as red on the table shown to leaders was gowns for hospital settings, although the Greater Manchester NHS partnership is expecting a consignment tomorrow, which should ease the situation. But overall, PPE in an improved position again. Lots of frustration expressed at the meeting about arrangements for testing, and what feels to people to be a confused picture across Greater Manchester with different capacity and overlapping schemes, and still capacity being put in without any reference to local authorities. And in Rochdale is a case in point where apparently a new facility is about to be opened, although has not been consulted upon locally. And it feels to us as though the government has been chasing the target on testing without fully thinking through the strategy at a local level and involving local leaders. And the appeal from us is that we have a much more strategic and coordinated approach to testing, given that we are going to need this capacity to function on an ongoing basis. A similar appeal around contact tracing. The meeting was presented with the emerging structure of a GM contact tracing system. The appeal being that we are fully involved in it so that we can make sure it works for us. And we are proposing an enhanced contact tracing system across Greater Manchester so that we can build high levels of assurance across the city region. Overall, the theme that we feel needs to be relayed back to government is there hasn't been sufficient local input in the PPE scheme, in the testing arrangements, and this needs to change as we move into recovery. So let me move to that theme now, because we had our first discussion today about how Greater Manchester will face the mountain which stands before us, which is some recovery towards a new normality, recognising that we are going to be having to live with this virus and social distancing for some time. And we had our first discussion about understanding what that means. Of course, it's critical that there is clear leadership on the issues of economic and business recovery, but also in terms of the discussion around investment in skills and infrastructure. So I have made two new appointments today to ensure that there is that clear leadership in those crucial positions. Cllr Elise Wilson, leader of Stockport Council, will be, as of today, taking over the economy and business portfolio for Greater Manchester, and I'll introduce Elise to say a few words in a moment. Alongside that, Councillor Sean Fielding, who already has the skills portfolio, will be adding the digital portfolio to that brief, so that we can capture quickly the benefits of a more digital economy that are coming from this period that we are living in, creating opportunities for new digital skills courses, building out the full fibre programme that we've already started. So I'm going to bring them in to speak to you both. So I'll start with Elise. Over to you, Elise.
Sorry, I'm on mute. First time I've done this, so you'll have to forgive me. Okay, so I guess the first thing I would like to say is a big thank you to Sir Richard, who has, up until a few weeks ago, led this portfolio. And I know that throughout the economy and business ecosystem, shall we say, he has been very well respected. And I wish him the best of luck in his new role in health, which I'm sure he will do really well at. So for me, I am actually quite excited about taking on this new role. As a business owner, however, I am crucially aware of the scale of the challenge that we are facing. We have already seen announcements around businesses that have announced bankruptcies or redundancies already, and that is not therefore to be underestimated. And I also think it is highly likely that different sectors of our economy are going to be affected differently and in different ways, and whether that'll be our towns and our cities maybe seeing things differently and having a different effect, or large business and small business as our self-employed or the employed. And I think so we'll need to be really focused on what it is that Greater Manchester needs to do to get through this together. And I think for me, the thing that makes Greater Manchester different, the thing that says we do things differently, is because we've always put the people of Greater Manchester at the very heart of what we're doing. And what we've seen in Greater Manchester over the last few weeks is how people have stepped up spectacularly. So we've, all been doing our bit. We have stayed at home. We have followed the Public Health England advice. We have been out working on the front line, doing all of those essential roles that we've needed to keep going. And we have been out volunteering and just helping each other out and being part of our community. And I have seen the same reflected in business. Business has been no different in that sense for me. We have seen businesses really stepping up, changing production to produce hand sanitizer or PPE. I know in Stockport we have a group of businesses that have come together and they're working on it right now together on how they can support each other through this. And I know the Greater Manchester LEP is exactly the same. They're already focused on how can we get through this, how can we help each other. And I think one of the really standout examples for me as well of how we've pulled together is the Stream Greater Manchester, the Stream GM that Sasha Lord and the United We Stream team have been leading on, and where we've really seen a pulling together of our creative and hospitality sector at a time when they have been massively, hugely, significantly affected. And we've seen restaurants making food and helping out in areas where they've needed that food and they've needed that help. And I think that's kind of the best of Greater Manchester, isn't it? That's just the best of Greater Manchester. And in the past, that's what we've done. We've pulled together. We've stood together on things, and I believe that's how we're going to build that better. That's how we're going to kind of get through this, is by doing it together. And for me, that's what I plan to bring, to stand shoulder to shoulder, to bring my shoulder to the effort, and to work with the businesses, with the self-employed, with those that are employed, and to really co-create and find a way through that's gonna mean that this is going to be Greater Manchester back open and back thriving and continuing that collective ambition that we all share. Sorry, I didn't have anything else. That's kind of where I'm at.
Thanks so much, Elise. I'm absolutely delighted that you're taking on this role, and with business experience yourself, I'm sure the Greater Manchester business community will really relate to that, and the energy and the passion that you'll bring to the role. From my point of view, there's no one better to lead the Build Back Better campaign, because while it will be challenging, there are kind of benefits that have come from this time in terms of a more active society, cleaner air, and it's how do we kind of capture those benefits, but also recognise that people in our city region need better employment security. So the people who've been out there working throughout this time in our hospitals, in our care homes, in our supermarkets, in our distribution, we want to put that notion of good employment at the heart of building back better, and there's nobody better place to lead that than you, and we're really grateful to you. But equally, it's going to be a moment when we need to give people the ability to retrain and get the new skills that they need if they are going to face redundancy and maybe needing to think about moving to a new part of the economy. And over the last couple of years, Councillor Sean Fielding has done fantastic work bringing through a new skills system for Greater Manchester, in particular the GMAX service that we launched a couple of months ago. But now that's going to need to go up a level, and particular focus on the digital economy, which is a real opportunity for us as we come through this, capturing the advantages of more home working in terms of relieving pressure on the transport system, giving people a better working life, as well as the opportunities there for digital skills. So I'm going to hand over to Sean now to take us through some of his initial thinking. But again, thank you to you, Sean, for taking on this expanded role.
Thanks, Andy, for that introduction, and I'm really pleased to join the press conference today because we've got some really good news to talk about, and talk about how we're already setting out how we want to rebuild post-COVID-19. I think it's sensible, again, as Elise did for Sir Richard, for me to pay tribute to Elise, who of course held the digital brief for the last 12 months. She's only been with us around the GM table for the last 12 months, but I feel like she really got to grips with digital, and she really talked it up at every meeting that I was at, and I hope to be able to do the same as well. So this is an addition to my existing brief around skills, which was a huge brief anyway, and it's something that we've been talking about for a long time around how do we support people as they need to transition in a changing economy? How do they access new careers in sectors that are going to grow? And how do they reskill when sectors that they currently work in or previously worked in are going to shrink? Now, when we talked about that just a few months ago, we were always envisaging that that was a period of perhaps a decade, and we had more time to support people through those transitions. However, what coronavirus has done is compressed that timeline into the space of a few months. And so the economy has already changed as a result of coronavirus, and we know that there are going to be jobs that just won't exist in the same numbers once we come out of the crisis, and there are many people that might be at the midpoint of their careers and will need support to retrain so that they can find an alternative role for the rest of their working life. So we're already talking about repurposing some of the skills funding that we have with the adult education budget, and of course making demands for more skills investment in Greater Manchester. We're talking about how we know that green technology is a massive potential growth sector, and an example of where we can do what you described as build back better, and there are going to be plenty of jobs created in that sector that we need to be equipping people with the skills to access. And then how we can repurpose things like GMAX as well to cater for a group of people that it wasn't necessarily originally intended to cater for. But what we really need to do here in Greater Manchester is make sure that at the heart of recovery, we're always thinking of people, because the government has, or seems to suggest that it has, an agenda around investment in the north and rebalancing the economy around the country. And a lot of that has been principally focused around physical infrastructure projects, you know, new railways, improvements to the road network, fibre connectivity, whatever it may be. And whilst that's great, we need to make sure that we're thinking of people in all that and ensure that they've got the skills that they need in order to access those jobs that are going to be created by that infrastructure. I think that moves me on, really segues into the digital element of my brief as well. We've seen some benefits, and I can talk about my own experience locally as the leader of Oldham Council. We've seen many benefits from increased home working not just the things that you've mentioned around cleaner air, less congestion, but also a better work-life balance for many of our staff. Many of our staff able to get involved in the community in a way that they weren't necessarily able to before because of working hours and commitments. We know that when lockdown restrictions are lifted, there's a potential, if more people are working at home, for local economies in towns and villages across Greater Manchester to be reinvigorated by having more people present during the day. And I think fibre connectivity, which I've already talked about, is going to be really, really key to ensuring that there is the bandwidth and the capacity for more people to be able to work at home. And the benefits that we've realised as a council and the combined authority have realised from having more people working at home can be realised by other organisations right across GM. So we really want to lobby now for gigabit capable broadband to be brought forward to 2023. The government's targets around that are currently based on a delivery period of 2025. And we know that we were working to get 45% of Greater Manchester connected up to gigabit broadband, and we want to go much further so that we can enable many more people to access super fast broadband and do more of this kind of thing, video conferencing and working remotely, which is really good. There is one specific announcement that I can make as well as during the press conference today, and that is the Greater Manchester Technology Fund. So that is £150,000 from the Greater Manchester Tech Fund, which has been used to purchase more than 500 digital kit bundles, which include laptops and the capability to get online. And that's going to be targeted at some of our most digitally excluded young people across the city region. So working with schools, those kit bundles that provide a laptop and an ability to connect to the internet and keep in touch with tutors, friends, family, neighbours, whatever it might be relevant to keep in touch with, are going to be dished out to some of the most digitally excluded across Greater Manchester. We're also hoping to work with Virgin Media Business and private sector organisations to increase the reach of that scheme too. Initially, it's going to be focused on recipients of free school meals, because that is a good measure of digital exclusion in GM, but we are hopeful to roll that out much more widely. So we are already thinking about the digital agenda and skills and its relationship with Greater Manchester post-COVID, but there's a lot to do, and we can really set an example for the rest of the country by putting people at the centre of all of our plans.
Thanks so much, Sean. That's a fantastic announcement, and it recognises that some young people's education and prospects will have been really damaged by this period that we're living through. And I'm really proud, actually, that we are recognising that issue and already starting to do something about it. So thank you for that, and thank you, Elise, as well. Just in summary, before we open up to your questions, one of the themes that came through our discussion about recovery with the 10 leaders was the need to raise confidence levels. You know, people will be feeling worried about what it means to go back to work and want to be reassured that there are standards in place, procedures to keep them safe. So the coordinated approach to testing that I was talking about and contact tracing is a really crucial part of building out a notion of a safe city region. And that's something that we all agreed we think we need to build up, you know, not just so people notice that nationally, but internationally, that this is a city region that's going to have safety at the heart of everything that we do as we build back and build back better, and that we don't make any compromises there. A safe place to visit, to study. It's going to be really important that we put that standards-led approach at the heart of everything that we do, and we will do that. So look out for a safe GM campaign. It will be coming, and we'll be wanting to build that confidence through it. One crucial issue I just wanted to touch on this is the question of public transport and the wearing of masks. It's an issue that's been addressed by the Scottish Government over the last 24 hours, and it's a debate we've been having too. If we ran Metrolink with just social distancing, we could probably get 20 or so people on a tram carriage. If we were to ask people to wear face masks of a certain standard, that could rise to, let's say, 70, 75 people. So, you know, depending on how we use PPE, it could have a big impact on how we get the public transport system back up to a decent functioning level. Now, no decisions have been taken, but I'm mentioning this because I think we need to have the debate with people. Do people feel that's the right way to go? And if so, we need to obviously begin to understand what the implications of doing that are. One of them would be being able to source much greater levels of PPE on an ongoing basis. And commitment I would make is, if we are going to go down that route, we would want suppliers across Greater Manchester to have the opportunity to supply that PPE that will keep our public transport running with high degrees of trust, but also they then could be supplied to other businesses who might feel that PPE might need to be incorporated into the way that they work. So these are the early thoughts, but we do need to put the question out there. What do people in Greater Manchester think about public transport going forward? Would they be more reassured if there were clear standards on PPE, and particularly the wearing of masks? And we need to hear that feedback as a group of leaders before we make any final decisions. But these are the questions that we now begin to address as we look towards the recovery process. So thank you everybody for listening to our presentations, and Ross, we'll now open up to everybody's questions.
Thanks very much. I'm going to take a question from Kim Pilling for the Press Association at 2:54. He's asked, are we gathering our own data on suspected and confirmed COVID cases in Greater Manchester care settings? Cumbria County Council is doing so and has publicly shared some of the data. So numbers of care home affected, number of residents, and a number of different indicators as well. So yeah, the question's at 2:54.
Well, I'll take that question, and it's an important one because of the concern we still have about numbers of cases in care homes, and sadly the number of deaths in care homes. On this call last week, I said that Greater Manchester had developed its own data reporting system, daily data reporting system for our care home sector, and that is being introduced as we speak. And the report to the committee today was the first data reports will be available for our committee next week. So obviously it's being done at speed, and hopefully this time next week we'll be able to give you much more up-to-date information about what is happening in care homes, not just in terms of new infections or sadly numbers of deaths, but also PPE levels and a whole range of other information. In terms of what we've got today, it's that Public Health England figure for numbers of alerts. As I say, it stands at 287, which is high and is a real cause for concern. So we are working hard to improve the daily data flow from care homes. It's going to be part of an alert system or an early warning system that would create a level of alert in relation to individual establishments so that we can find out those which need more help. It's on the way, but it's not quite fully in place yet.
Thank you very much. I'm going to take the first question from Joseph at the Bolton News and Bury Times at 3:01. He's asking, does Greater Manchester have the capacity to test its share of the government's 100,000 tests a day commitment? And whose responsibility is it to make sure that frontline staff are being tested, individuals, employers or local authorities?
Well, the report to the committee today, Joseph, was that Greater Manchester has seen a big expansion in capacity, but it's been done in a haphazard way without sufficient local consultation, as I was explaining. Now, we're pleased to see the expansion of capacity, but we see a pattern still in that things are being done at a national level without regional and local coordination. If there was that local and regional coordination, we would probably make better decisions about the location of testing capacity. We wouldn't be duplicating, as we've got in the case of Rochdale, where there's an existing facility at Hopwood Hall and a national scheme run with the Army is going to come in a different location, and the potential confusion that creates. So this is why I was saying I think there's a feeling that there's been a chasing of this target and not consideration given to a more coordinated approach to testing. So the good news is the capacity is growing all the while, and we're grateful for that, but we need to make sure that it's testing the right people in the right places, and we're not yet entirely sure that that is the case. And we obviously want to work with the government to take the new capacity and use it to the most strategic benefit that we can, and that that maybe has to come after this week that we're in, but we believe that's what needs to happen next.
Thanks, Andy. There's a question from Andy Bounds for you again at the Financial Times at 3:15. He's asked if you could say more about the gowns situation, please. How many hours, days, supplies is there? Where are the new gowns coming from? And is there any effort to set up GM manufacturing capability? And there's a number of Metrolink questions that have also come in, so I'll come on to them next.
So on the gown situation, we are down to a small number of days supply across our system, Andy, and you know that we're running a mutual aid system, so we are taking supply from certain hospitals and pairing it up with those where there's least. So we have some efforts in place there. As I say, there's a delivery expected tomorrow, and that should take away the immediate challenge, but obviously we won't be certain until we have that delivery. The phrase used on the call this morning was that it was touch and go with regard to the supply of gowns, and that's not a place that we would want to be in at this particular time. With regard to their local efforts, Manchester Metropolitan University have done fantastic work with I think the Fashion Institute and others to come up with new specifications for PPE, including gowns that then can be made by local suppliers. So yes, we have made efforts to bring that stock in. We had a real problem about 2 weeks ago where one of our hospitals was seriously short and had to improvise. That isn't the case for now, but as I say, we are down to a small number of days supply, and it's a situation we're watching extremely closely.
Thanks, Andy. I'm going to take Kevin Fitzpatrick's question. These are 2 questions at 3:19 for you. You'd set a deadline of today for the decision on Metrolink. How long can the service continue without confirmation of the amount of government money? Also, figures for deaths in care homes due to be released daily now by government. Have they been forgotten in the initial response, and has that led to more death?
So, Kevin, thanks for your question or questions. On the first one, I'm told that we are going to hear today. I've just come off a call with the Transport Minister, who told us that white smoke had been received from the Treasury, or seen from the Treasury, and that an allocation is about to be communicated to us, which I checked just before this call because knowing that you would ask, but we still don't have that figure. My suspicion is, as I said, it's not full cost recovery. So the question then comes to myself and the leaders, what do we do about the shortfall? If there is a shortfall, maybe it will be full, but I doubt it. And I should be able to confirm that later today. So we'll have a decision to make, I guess, depending on how much funding we've got. But it goes to the heart of this issue I was raising about social distancing on trams, or wearing of PPE and masks on trams, because obviously if it's social distancing, the loss of revenue is much greater because of the fewer people that we can carry. If it's PPE and masks, we might be able to carry more people and thereby reduce the losses. So these are really complex questions, and we need to surface them with the public, because we need to hear what people would think about wearing of PPE on public transport. As I said, I haven't come to a firm view, but I can see how it might help to have more PPE being used, as the Scottish Government are clearly saying as well. But obviously we need to understand the practicalities of that, and indeed the advice from the experts. Public Health England haven't given us a view on it at the moment, and that needs to change in my view. On the second point, I think care homes were somewhat neglected in the initial response, and I think there was a particular concern raised on our call with leaders this morning, whereby the advice was given to move people out of hospital into care homes without the necessary level of testing and assurance about those cases once they arrived in care homes. We've been in a position with hospitals over the last few weeks where there has been capacity in the system, and we would say going forward that there needs to be more coordination between hospitals and care homes. I've made this argument over many years that social care is often the poor relation. And I think the same has been true here. I'm proud that we took steps to improve reporting of figures from care homes. I'm pleased to see that the government recognised that daily reports are important, but you would have hoped that would have come earlier in this crisis.
Thanks. I'm just going to take 3 questions that one after the other. Andy Bounds at 3:28 asking, is it a mayoral competence to mandate the use of masks on trams and buses? The second part of Jen Williams's question, so I think that's the first part of evidence, is the idea of wearing masks partly to find a way to make the financial numbers stack up on Metrolink? And Hannah Miller, who asked something similar, are you really suggesting you might look to insist on face masks in some public spaces, for example, Metrolink, even if the government doesn't mandate that? So 3 similar questions.
Well, it's first and foremost being driven by that need to raise confidence that I was talking about. You know, we are going to have to work hard to assure people that public transport is safe. And, you know, that's why the question of PPE comes into that equation. It's not principally, Jenna, an issue driven by the costs. Because it's safety, isn't it? It's safety first. That's what's got to be done. And if the experts tell us that social distancing is the only way to go, well, that is the only way to go. But we've got a vacuum at the moment. Public Health England haven't given clear advice about how public transport can function going forward. So, you know, in the absence of that, we are having to think through, well, what creates the confidence? And some will argue that PPE would create the confidence in closed spaces. Others may say that that isn't the way to go, and it's why we're just surfacing the issue, because it is an issue. It's a debate that has to be had. Obviously, in Asian countries, the wearing of PPE on public transport has become fairly standard in the last decade, and I know in other European countries they are going down this route as well. Scotland, we heard from yesterday. It's a discussion that we need to have, because of course in the end there's also a consideration about convenience for the travelling public. If the wearing of masks allowed more people to get on trams, of course that would lead to fewer queues and it would make things work better for people. But it could only be done if it's not compromising in any way on people's safety. So it's a really challenging question. I'm not one to just sit behind closed doors and have that debate. I think it's one that needs a public airing. I think we would be able to set the standards for our own public transport system, Metrolink, but we would rather it be clear guidance that comes from a national level, and particularly from Public Health England. So I'm actually calling today for Public Health England to issue that guidance, because I think it will help myself and the other 8 metro mayors around the country.
I'm going to bring in Cllr Wilson on the next question. It's from Nigel Barlow at About Manchester at 3:21. He's asked, being involved in business and seeing the damage that's been done, do you believe that the point is going to come, or maybe has already come in this crisis, when the cure is going to cause more damage than the illness?
Yeah, thanks for the question. I think we need to think about what it is that we can do that can have an impact that actually means that that's not going to be the case. And I think we can do a lot of learning from what's been in the response so far to this crisis, so that when we're looking at recovery, we can apply that learning. So Andy was talking earlier about testing or PPE, and we've seen that there's been haphazard and there's been difficulties, and where we've seen things work well, what I feel where we've seen things work well is where actually we've worked together. So government has worked with local government, and local government and government have worked with business and the voluntary sector and the people of Greater Manchester to actually make sure that we find things and solutions to problems to help avoid the worst case scenarios, so that actually we can get through this in a positive way. I'd say it's about us taking that learning to think about the testing, think about the contact tracing, see what we can do about that, build that confidence, the safe city region, because with confidence business has an ability to really innovate and be really creative. What we've also seen is, yes, there's been damage. Yes, we've seen redundancies announced and bankruptcy, but we've also seen, like, you know, real innovation and businesses working in a really different way, and keeping going. So what we need to do is ensure that we have those right interventions, and that really we learn the lessons of where we can do things better, because I genuinely think we can, and we can make sure that we find ways, and Sean might want to talk about it, but about helping people redeploy into different jobs, and making sure that we can get through this together. So I think without intervention, without actually doing something, if we just sat back and wait, then yeah, it could be really bad. But by doing something, and that's what we're doing here, that's what we're focusing on, ensuring that we've got that leadership in place, ensuring that as a Greater Manchester we have our focus on that, and we do that in a collaborative way to make sure that we're delivering the right thing for Greater Manchester.
Thank you very much. Just checking the Sean, if you want to come in on that one at all. That's fine.
I think if I could say, I think James is the controller. I think we've lost Ross at the moment. So James, could you go back to Ross, please?
Sorry, no, I'm here. I think there was an issue with my microphone. Apologies. Can you hear me now?
Yep.
Fantastic. Apologies. So Joseph from the Bolton News and Bury Times, he's asked how many rough sleepers have been asked to leave or have voluntarily left temporary accommodation arrangements during the coronavirus crisis. And there's also a specific question about Fairways Lodging Press, which I think might need to be dealt with by the council that commissioned that service. And then below that, a related question on homelessness from Paul Burnell at 3:03 PM. Have we had any significant rise in the number of homeless people due to the shutdown of bars and restaurants, as has been seen in London?
Joseph, first of all, on your question, we have had significant numbers, I think, of people who've had to leave accommodation. I haven't got those numbers to hand, and I would have to get them to you after this briefing. I don't know if that includes Fairways, but again, I will find out for you. But we don't just put people on the street and, as you say, let them then perhaps pose a risk in a different way. You know, we are trying to find the right accommodation for people and the right support for people, and the team have done a fantastic job in doing that. Paul, in terms of your question, as I said, you know, there's a significant number of people, increasing number of people who need our help, and that's reflected in the number of people who've been accommodated so far, 1,130, which is so 1,310, I should say, which is a pretty big number. And the figure that I've got for newly homeless is 172. Now, whether those are people who worked in the nighttime economy or not, I don't know, and have to look into that. But it shows you that lockdown has actually created homelessness, and yet the government is saying that it wouldn't pay for that. And as you've seen on the graph, it's not giving our councils the same level of funding that it started by giving them. It's actually starting to remove funding from them. So there's a serious set of issues here about rising homelessness caused by lockdown and a lack of resource to meet those pressures. Although we're continuing to do it as Greater Manchester, you know, we are trying to find a place for everybody.
Thanks very much, Andy. And then the final question today is from Nigel Barlow. Not the final question because one just popped up, but take Nigel Barlow's question anyway. He's asking you, Andy, re face masks on trams. They ran an interview with a public health professor at the University of Manchester who said the wearing of masks has limited use in preventing the virus being transmitted, that social distancing was far more important. Why then does the wearing of masks cripple the amount of people who travel on a tram carriage, and do they not need to be, and do they not have a false sense of security to people? That's Nigel Barlow at 3.
Well, thanks, Nigel, and I don't know, possibly, you know, that's an issue that needs to be looked at. And I suppose what I'm saying today is we need guidance, and we need Public Health England guidance on this, because whether we go with public transport using social distancing or whether we go with public transport where PPE is used, you know, there's obviously a big difference between those two things. I think what would be worse would be just to leave people a bit confused and just to say, oh, well, you know, you can if you like. I think that wouldn't be a good enough message. I think we need clarity from a national level over what is the best and safest way to run public transport, but at the same time, you know, have a level of occupancy of buses and trams that allows the city to reach a level of sort of decent functionality. So, you know, this is an issue that needs to be addressed and needs to be addressed quickly, because we need to be thinking now about how do we, you know, begin recovery. It's not in any way a call for an easing of the lockdown. That will be done when the government says it's right. But we have to think now about if they do make moves in that direction, we've got to be ready and have thought through the implications. So, you know, it's a debate to be had. I think the wearing of masks can reinforce the need for social distancing in some ways as well. So that shouldn't be discounted. But clearly there is a benefit from wearing a mask. And I would say maybe it needs to be more than just a scarf or a bandana, as some have said. We just need guidance on it, because when we get that clear guidance, I think we'll know then what that means for our public transport system, and we'll be able to move ahead on that very clear basis. And I think that needs to come sooner rather than later.
Thanks, Harry. And what looks to be the final question at the moment is another one from Joseph. He's asking, you've spoken of your legacy, you've spoken of your hopes for a legacy in tackling homelessness during the coronavirus crisis. What will you do to prevent these people from ending up back on the streets when this is all over? And what other legacies are you hoping will shape the new normal in health and social care, for example?
Well, we mean what we say when we talk of Build Back Better, which Elise spoke about. I hope that there is a legacy for homelessness, as I've said before, but there won't be one if we get the Treasury reverting to type and trying to chip away at council finances. I don't think that will deliver a legacy. At the start of this, we were told, you know, spend what you need to spend to bring everyone in. That was the policy, everyone in, which was the right policy in my view. But now we're kind of seeing our councils getting reductions in funding on the latest round, as I've shown you today, and therefore potentially not the funding to meet those people who are newly homeless, which I've also said is rising as well. So the legacy of this is kind of in the balance at the moment. And my call on the government would be, you know, just recognise the exceptional nature of this moment. If you fund our councils to be able to cope through this, and you know, make up all of the income that they've lost, you will bring the recovery forward, and actually you'll probably reduce the sort of ongoing damage of this period that we're living through. And the same would apply for businesses. You know, the appeal would be to continue a furlough scheme for those sectors that might find it hard to bring all of their staff back early. The more that we kind of protect of our economy now, the more that we will be able to build a legacy. I'm offering up to the government use of the Greater Manchester Good Employment Charter. If there is going to be ongoing support for business throughout the rest of this year, I think it must be linked to good employment standards. I'm not at all comfortable with the idea that the essential workers who we've all relied upon are not, it would seem, essential when it comes to their pay and job security. And that isn't right or fair. I think we need to see change in our economy coming through this, and good employment linked to government support, and particularly payment of the living wage, which I think should be an absolute guarantee for everybody working in our care system and in our hospitals, the real living wage, but actually should be a standard that goes right across the economy, recognising that there are people who are essential to the running of our economy who currently are receiving poverty pay and insecure contracts. If we need those people to turn up for work every day, that's not the way to reward them. They deserve better than that. On social care too, you know, I'm looking at the social care system here that has really kind of struggled with what it's had to try and cope with in recent weeks. It's it was in no position to face what was thrown at it because of the failure of successive governments to reform the funding of social care. It's a malnourished system that doesn't have the capability to deal with things, and actually it's a fragmented system that, as I've described today, doesn't have that kind of systematic support that we find in the NHS. You know, we're looking here towards the 75th anniversary of VE Day. You know, the Second World War gave rise to the National Health Service. I hope that this period we're living through will give rise to a reform of a similar kind, i.e. A social care system funded from taxation, free at the point of use, that can be fully integrated with the National Health Service. You know, if there's one major legacy I would like to see from this more than anything else, is a social care system that has the strength and the capability, the standards and the pay for its staff, that means it's if ever anything like this was ever to happen again, we would have a social care system that would be much better equipped and resourced to be able to stand up to it.
We've got a question from Hannah Miller at 3:48. There are reports that the Nightingale Hospital is being underused. Are there any conversations going on about using it for non-COVID cases?
Thanks, Hannah. I think there are conversations that are taking place, although there's no change, as I understand it, to the arrangements for now. There are still patients in the Nightingale, and of course it was the right thing to do because nobody knew how this situation would develop. And I must stress, of course, that there is always the question of a second wave, which potentially could come over the autumn or the winter period. And I think it is prudent to have that hospital capacity, that overflow capacity in place should we face that second wave and everything it might bring. But of course, you know, it is a resource that is there to be used. No decisions have been made as far as I understand it. I will correct that if I've got that wrong, but I think there is some discussion about how that capacity might be used throughout the remainder of this year. But of course, we've got to have our eye on a potential second wave, and it could be that we need that capacity very much through the coming winter.
Thanks, Andy. We've no further questions. I don't know if you or any of the other leaders have any final comments.
Sean, should maybe offer to Sean or Elise? Sean first and then Elise.
Yeah, thanks, Andy. I think just the question about legacy is really interesting, because in the same way that I talked about having redesigned the way that we work and increasing the numbers of people that are working from home, and that could be a potential legacy from this. The way we have redesigned care pathways in Oldham as well, and I know that many other local authorities around Greater Manchester have done, should really be a legacy too. It's something that we really wanted to do anyway, and we're looking at trying to do over a period of probably about 18 months to 2 years, but we've had to compress the timeline as a result of coronavirus. And we really like to be able to sustain that, because it's reduced the pressure on acute care and reduced the pressure on hospitals and got more people into alternative settings where it's better care and less expensive to provide the kind of care and treatment that people really want and need. But I think that the thing that's important to us is that it's better quality of care often. So that's what we'd really like to be a legacy. And you're absolutely right to say that that is not going to be a sustainable legacy if we don't get the funding to back it up. We've had a reduction in the funding that we've been allocated compared to the first tranche of COVID-19 bailout. And that's on top of, in Oldham, the £215 million that's been taken out of our council over the last 10 years. And many other local authorities, well, all of the local authorities around the conurbation have faced cuts to their budgets. So on top of the cuts that have happened in the last decade, not receiving enough money to pay for the expenses that we're incurring as part of this does leave a real risk that we won't be able to realise some of the benefits that we've talked about from having gone through this experience. But that's just my final thought.
Yeah, I suppose my final thought is really I just agree with what's been said, but to sort of say, you know, we have in local government gone through 10 years of real significant change, and local government's shown itself to be truly dynamic, with a real ability to change its shape, integrate with its communities, and deliver in a really efficient way. And what we've learned is that, you know, we're better together. We are better when we work together with others. And I think for me, the legacy will be really recognising the opportunity that local government brings to not just getting us out of this, but also to set us on a new footing in a new normal. And that I would really like to see government genuinely engaging in what we can do as councils, as boroughs, as city regions, to really help change the new shape and define the new normal. I think there's a huge possibility there.
Thanks both, and absolutely to follow on from Elise, there is an opportunity. There's a massive challenge, of course, but there is an opportunity for a legacy on homelessness, on clean air, on employment standards, on social care, and I would implore the government to work with us, and let's deliver that that legacy. Let's capture some of the benefits of this really tough time that we've all been living through. And we're ready to play our part in that. We believe very firmly that local economies, mayors working with our council leaders and our 10 districts, are the best place to lead this recovery process, as Lord Heseltine argued the other day. And it's an argument I'll be making to the government with our other metro mayors later this week. You know, don't make us bid for pots for this and pots for that. Trust us, give us devolve funding, and let's get levelling up back on the agenda. If you look at that graph again that I've shown you today, that would say to you that levelling up is off the agenda, and that can't be the case, because some of the north will need more help to recover from this, and we need the government to go back to what it was saying before. In terms of the return to normality, I think Jen asked a question about NHS capacity coming back, and yes, we've talked about that today, Jen, opening up NHS capacity to non-COVID patients, particularly cancer patients. So arrangements are in place to begin to boost the capacity across, or the activity, I should say, across the NHS. You talked about whether we've ruled out mothballing Metrolink. We haven't seen the deal, and I will issue a further quote later today when I have seen the deal. You know, it all depends on the level upon which the government are meeting our £5.5 million shortfall. If they are getting close to covering it, yeah, mothballing is off the agenda. If they're only giving us half of it, or a bit more than half, then it's a challenge that I'll have to discuss with the leaders. But recovery won't happen in the way that it needs to happen, as Elise was saying, if we're doing it on the normal basis of the Treasury penny pinching and cutting funds away and making councils share the burden. The councils haven't got the ability to share this burden. They need costs recovered. We all do. Transport needs costs recovered so that we can come back quicker and come back stronger and build back better. So we're here to help. We want to work with the government. We're ready to do that. We're beginning to set our thinking on recovery, as you've heard today. I hope you found some of that interesting. Thank you again for joining us this afternoon. We do value your input and your tuning into these sessions, and we look forward to seeing you all next week. Thank you very much.